it's important for anybody else who's trying to learn from our experience to understand that you will never get full buy-in. And the rule of thumb that I always, I don't know if warn's too strong a word, but I always mention to people is that if I'm speaking to them about improvement, you will get 20% of your staff buying in instantly. They're the change agents. They're up for it and they'll be good. And you actually know who they are right now. 20% will not buy in and probably never buy in. And you'll also know who they are fairly quickly. So start with that realization, and your job is to encourage and engage the change agents at the top end to help you bring the other 60% your way, whilst remembering not to ignore the 20% who are not engaged. There may be that some of them could be engaged, but my experience is that quite a lot of them will not be able to be engaged. But you mustn't lead them, you need to manage them, because they can be a disruptive element to the change management. So you can't just ignore them, you've got to manage that in whatever way. So capitalising on those that were already bought in and using them to persuade the others and to influence the others. There's no one specific thing that you do, it's just a whole process of identifying your change agents, promoting them, sometimes actually promoting them in post, but promoting them in terms of encouraging them and giving them the resource to make differences. Clinical buy-in is often said to be a difficult thing, and rightly it is. And if you can get it, you can do wonders without it, but you can do miracles with it. Yeah? It does make a difference. And they will want to see data, which has been spoken about several times today. They want to see data that is meaningful to them and their services, and that translates into actual patient improvement and patient improved experience. The whole focus of the improvement processes that we use, which is unashamedly the Toyota production system or the Toyota improvement system, depending on which school of thought you come from, which is commonly known as Lean, which we've modified for the health sector and calling it the Bolton Improving Care System. The absolute focus of that is on quality. It goes back to W. Edwards Deming. Focus on the quality will improve and the cost will reduce. If you focus on the cost, I guarantee the cost will go up and the quality will reduce, and we see that almost every day in knee-jerk reactions from hospitals and departments. So we were absolutely clear we would focus on the quality, and that means reducing defects in its simplest level. And a defect is a patient waiting too long, a cancelled operation, a result that's incorrect, a lost blood sample. There are all sorts of things that can be defect. A request that's made of a service, but it made in the wrong way, so it can't be performed. Patient misidentified. These are all defects. So focus on those, and what you'll straight away find is that you can reduce rework, so you're not having to do things over and again, and that instantly takes cost out. And the planning stage, looking at the value stream map, as we would call it, as soon as you do that, you understand that every service and every part of a service I've ever mapped in my career, and it's been a lot, 95% of that value stream, as we call it, is waste. And what by waste I mean these are things that do not add value to what the customer was asking you to do, what the patient required from you, what the clinical team required from you. It was about things waiting. Samples being, from my environment, which is laboratories, samples being moved from one place to another place. Well, that had no value, but we seem to be doing it all the time. There are the bits that add value, so in that environment I've just described, that might be actually performing the test, interpreting it, and giving it to the doctor who's looking after the patient, and that's all really good value. But the sample being transported around the hospital, waiting for someone to do something with it, that's not really helped anybody, has it? So get rid of those steps, and two things happens. You'll reduce cost, you'll get the result out more quickly, which improves quality. There'll be fewer steps, and every step will have an associated error rate, because nothing's perfect. So if there are fewer steps, there must be fewer defects, and fewer defects means better quality. So it actually is very, very obvious. That's all you need to do.